Namaskar. Today we'll study the fibrinolytics and antifibrinolytics. So fibrin, it is your factor 1. So factor 1, the fibrinogen is the inactive form which is converted to fibrin, and that becomes the clot. So fibrinogen is the soluble form which is converted to the loose fibrin threads, which in presence of the fibrin stabilizing factor, that is factor 13, is converted to stabilized fibrin threads or clot in presence of thrombin. And thrombin is the activated factor of factor 2, that is prothrombin, and prothrombin is converted to thrombin in presence of prothrombinase. If we recall the steps of blood coagulation, step 1, formation of prothrombinase, step 2, prothrombin to thrombin, and step 3, fibrinogen to fibrin, fibrin, insoluble fibrin or clot. So this clot inside the blood vessels is known as thrombus. That is, this thrombus is formed in absence of bleeding due to inappropriate activation of the hemostatic mechanism or this blood coagulation mechanism. So thrombus is the clot inside the blood vessels, and when this thrombus moves, it becomes embolus, and this embolus is the moving clot in the blood vessels. So when we want to dissolve this clot, then we can use fibrinolytics. So this fibrin, which is the insoluble form of the clot, is converted to soluble fibrin fragments by plasmin. So plasmin can dissolve the clot, and this plasmin is formed from the inactive plasminogen in presence of plasminogen activators. Okay, so plasminogen plus plasminogen activator is converted to plasmin. So fibrinolytics are the drugs which helps in activation of plasminogen to plasmin, and antifibrinolytics, they inhibit this conversion of plasminogen to plasmin. So let us see a diagrammatic view. Here this is plasminogen. Plasminogen is having two sites. One site is for plasminogen activator. This is the site for plasminogen activator, and this is the site for lysine binding site of fibrin. So this is the site of binding for fibrin. Similarly, plasminogen activator has also two sites. One site is for fibrin binding site, and the other site is for plasminogen binding. So plasminogen activator and plasminogen both bind, then fibrin binds to both of them. So fibrin binds to both plasminogen as well as plasminogen activator. So here you can see, so fibrin has two sides. One side binds to the plasminogen activator and the other side binds to the plasminogen, and this is the lysine site. So when this binding occurs, there will be activation of fibrinolysis and there will be degradation of the fibrin, and so fibrin degradation products will be there. In this way, there will be dissolving of the clot. Okay, and then if we use this lysine analog, any lysine analog we use, then that will bind to the plasminogen site, this site where this fibrin should have fibrin has the affinity to bind. So when we use any analog of lysine, that will act as the inhibitor of fibrinolysis, so that site will be occupied and fibrin now cannot bind. So fibrin can bind to the plasminogen activator but cannot bind to the plasminogen site. So that will result in inhibition of fibrinolysis. So in this way, fibrinolytics and antifibrinolytics act. Now fibrinolytics can be classified as endogenous plasminogen activator and exogenous plasminogen activator. Endogenous plasminogen activator like tissue type plasminogen activator, urokinase type plasminogen activator, kallikrein, neutrophil elastase, all this can act as endogenous plasminogen activator. And this tissue type plasminogen activator selectively activates fibrin, which is bound to the plasminogen, not to them which is circulating. So they have no action on the circulating plasminogen, but to that plasminogen which is bound to the fibrin. And exogenous plasminogen activators are streptokinase, urokinase. Some of them are enzymatic and some are non-enzymatic. So streptokinase is the non-enzymic protein. Urokinase is the enzyme isolated from human urine, and this streptokinase is extracted from beta hemolytic streptococci group C, okay, bacteria. And others like alteplase, deuteplase, retiplase, anistreptase, these are all recombinant tissue plasminogen activators. Okay. And all these fibrinolytics are used in deep vein thrombosis of leg, pelvis, shoulder, the pulmonary embolism, myocardial infarction, unstable angina, peripheral arterial occlusion, etc. Then antifibrinolytics, the drugs which inhibit plasminogen activation and dissolution of clot. So the antifibrinolytics are the drugs which inhibit this plasminogen activation, and they can be endogenous or intrinsic, and exogenous or extrinsic. So endogenous are like plasminogen activator inhibitor, which inhibits the tissue type plasminogen activator and urokinase type plasminogen activator. Then alpha 2 antiplasmin, which binds irreversibly to plasmin. Then alpha 2 macroglobulin, it also binds to this plasmin, but it has relatively low affinity as compared to alpha 2 antiplasmin. Then exogenous, we can have either natural or synthetic lysine analogs. So the natural aproteinin inhibits plasmin, kallikrein, etc. And the synthetic lysine analogs, they simply inhibit this site so that fibrin cannot bind. So synthetic lysine analogs like epsilon amino caproic acid, tranexamic acid, which is chemically 4-aminomethyl cyclohexane carboxylic acid, para-aminomethyl benzoic acid. So all these can be used in case of cardiac surgery to reduce blood loss, in gastrointestinal bleeding, acute upper gastrointestinal bleeding, bleeding in the urinary tract, primary menorrhea, oral surgery, so bleeding after thrombolytic treatment or overdose. So in all these cases we can use antifibrinolytics. So this is all about fibrinolytics and antifibrinolytics. Thank you.